How do we age? Well, after about the age of 30 or so, our skulls continue to remodel and start to change shape a little bit. So imagine that you're a juicy little plum when you're younger, and within that plum there's flesh and a pip, and that pip over time starts to shrink a little bit and change shape, and in an irregular kind of way. Then the flesh around the plum, it starts to wither a little bit or lose volume, and it starts to slip around this changing pip. And the skin, it's been beaten by the sun a little bit, and it loses its elasticity and firmness as well. And the same thing happens to our faces. So through aging and through the years after 30 or so, our skull changes shape, and we tend to lose it in specific areas. The bone is resorbed in selective areas at an uneven rate, but more often around the orbits, within the cheeks, around the upper teeth and down into the chin. And you start to sort of see those changes around about mid-30s or so. And it's really interesting because you start to notice that there's more shadowing, more kind of definition between different areas of the face. If you look at a child, they're gorgeous, they're just contoured and soft, and one area just rolls into the next. When you start to sort of hit 40, you have a chin region, a cheek region, an eye region, hollows, you notice that the bags are a bit more prominent. And all of these changes occur because you're losing that table of support that sits as bone underneath those soft tissues and supports them. So over the top of that bony sort of skeleton, we have changes in our fat as well. We've got lots of layers of different types of, or lots of layers of fat, and it tends to be lost at different places as well. And we notice a lot of changes through age, with some hollowing through the cheeks and temples, under the eyes, around the mouth region again as well. And skin, it changes. You shut your eyes and you can touch it. It's a feel thing. So in terms of what you can do, there's a whole range of options out there, from fillers to botulinum toxin or muscle relaxants, to laser, to IPL, to Fraxel, to dermastamp or needling. There's so many things, and it's really nice to sit down and have a chat with your practitioner about the difference between all these as well. With a filler, how often will you do it? I don't know, between 6 months to every few years, but not more often that's needed. You want to keep within the realms of what's natural, within the boundaries of nature, and to only really restore what's slowly being lost in order to prevent further changes from occurring, but never to go beyond anything that's sort of pleasing to the eye, and to maintain a kind of I suppose, a deference to really the art of what nature achieves and has learnt to do over thousands of years.